Hi, everyone. I'm Dr. Elisa Bronfman, a psychologist from the Family Medical Coping Initiative. Welcome to our family education webinar at Boston Children's Hospital. Today, we're talking about siblings. The Family Medical Coping Initiative is a program through the Hale Family Center for Families at Boston Children's, and it's a multidisciplinary effort spearheaded by psychology, me, social work, Annie Banks,
Welcome, everybody.
and child life, Gail Windmueller.
Hi, everybody.
The program was developed to provide education to families and staff about ways to enhance child and family coping with medical conditions. Within the next week, you will receive an email with a recording of this webinar, and it will also be on the Boston Children's Hospital YouTube page on our playlist. So today we're really happy to welcome Dr. Lauren Mednick. Dr. Mednick received her PhD in child clinical psychology with an emphasis in health psychology from George Washington University. She's been at Boston Children's Hospital for 17 years and was the director of the Medical Coping Clinic service. She joined the Department of Surgery in 2020. Dr. Mednick's clinical and academic work has focused on children and families and how they effectively cope with acute and chronic medical conditions, which began early in her career as a child life specialist prior to getting her PhD. I've known her for most of her time at Boston Children's Hospital, and she is both a fantastic clinician and a wonderful speaker, so we're delighted to have her today. She's also traveled with Operation Smile to help children all around the world, and she ran groups for siblings of children with medical conditions in the Medical Coping Clinic. So she's a real expert in our important topic that many people have been asking for a long time. So we're eagerly awaiting her talk. Also, at the end of the talk, feel free to ask general questions to either Dr. Mednick or any members of the Family Medical Coping Initiative via the chat function. Thank you. Dr. Mednick.
Thank you, Elisa and Annie and Gail for inviting me to speak today. This is something I've spoken about before, and I feel doesn't get enough attention. I feel like, and understandably so. As a parent myself, when something's going on with one of my children, that's who all my focus is on, and oftentimes I forget, oh gosh, the other one might be struggling too. And so I think I'm really happy to be here, and I hope that there are some tips and strategies and ideas that I talk about today that will help families and caregivers. So I have nothing to disclose. We'll start with that. And I'm just going to try to move these pictures up a little. Oops, sorry, hold on. Okay. There we go. So I wanted to talk a little bit about my goals, and there's two main goals for today. And the first is to just review how children can be impacted by having a sibling with a medical condition. And so most of you here, I'm assuming, are parents of kids with medical conditions. And so this won't be something that's so enlightening for you. I think most of these things you'll say, yes, we know that. But I think it's a good place to start to sort of go over those things and have a sense of, what siblings say they experience. More importantly, and where I'll spend the majority of the time today, is talking about ways to support kids with medical conditions. Support siblings of kids with medical conditions. So what are things we can do to help them have the impact be more positive than not? And I'm going to put a disclaimer here, and I'm going to come back to this multiple times, but I really want to say this many, many times, is that as you're listening to this talk, especially when I get to the sort of tips and strategy section, it might feel very overwhelming, and it might feel daunting I have to change everything I do with my children, and there's so many things to do. And the reality is none of us do all those things. And again, as a parent myself, I strive to be a certain way. And the reality is I don't hit all of those buttons all the time, and that's okay. And that's normal. And so even if you leave here thinking, I'm going to work on that one thing, that's huge. So please, I will give you the whole bucket list, because, everyone wants to do things differently, and some things are easier for some people and harder for the others. So I'll give you a whole bunch of different ways to support children, but please don't leave here thinking, oh my God, I have to change every way I parent, and there's so many changes I have to make. Like, think about what's one thing I can do maybe a little differently, or maybe do more of. Maybe I'm already doing it. So we'll start with the first goal, talking a little bit about how kids are impacted. And so let me start with some feelings that kids often have. And so some of the feelings that kids often experience are jealousy. So you can see this girl in the front, and her parents are taking care of, I would assume, her sibling in the back. And she might feel jealous. She might see, oh, they spend so much attention to my sibling. And, you know, I always think it's a funny thing. You know, you're always going to appointments with them, or you always spend time with them. And I think to myself, well, yeah, but they're not doing something fun. But from the sibling's point of view, time is time. And they're getting, you know, so they might feel some jealousy that they get to do things, or maybe they don't have to do things that their you know, well sibling needs to do. Another common feeling is worry. And that's worry maybe about their sibling, but it also might be worry about their parent, that their parent has to do certain things or feel a certain way. It might be worry about themselves, how they're impacted. Am I going to have to miss out on things? Are people going to ask me questions? You know, worry is a very common experience of these children. Another common experience is sadness. And again, this might be sadness for the sibling, for the parent, for the kid themselves. Some kids describe feeling confused. I think it's very frequent, a frequent occurrence for parents to, you know, be talking a lot to their kid with a medical condition, and they know what's going on, and sort of forget to include the other members of the family who might not have been at the appointment or might not get the preparation work for the surgery. And so they might feel confused about, well, so what's happening and what's going on? Anger. So, and this comes back to sort of the idea of maybe jealousy, you know, that why do they get to do this? Why don't I? Angry that just the situation, this doesn't seem fair, is something we hear a lot. And thinking about many of these feelings, especially the anger, and I would say jealousy, you know, think about the idea that in all sibling relationships, there's some comparison, competition of some sort that's pretty typical and normal. And so you can imagine it might be even more heightened when there's something so different about a sibling relationship. And then, you know, some kids might say they feel embarrassed. And are they embarrassed that maybe their sibling looks different? Are they embarrassed to talk about where their sibling is, or have more attention on them because their sibling has a medical condition? So these are all really common feelings. I think one of the most common ones that I didn't put a picture up because I didn't know how to illustrate it was the idea of guilt, which I think can be elicited by many of these feelings, right? You know, thinking, oh, I feel bad that I'm jealous. Like, I shouldn't feel jealous that he has a medical condition. Or, you know, why did I have that angry thought about my sibling? Or why him and not me? You know, so I think there's a lot of guilt that happens too. So to continue a little bit longer on sort of the experiences and feelings that I frequently hear that kids have, and I'm sure as parents you frequently hear too. We'll talk about a few other things. So I'm going to illustrate this with different quotes and talk a little bit about them. So you might hear your kids say, "You always spend time with him." So what we know is that parents of kids with medical conditions have to use a lot of their time and energy to take care of those kids. And it's not just the going to the appointments and giving the medicine. There's so much around it. It's arranging the appointments. It's ordering the medications. It's navigating health insurance. Worrying takes time and energy. Monitoring health. You know, sometimes if a kid might have diabetes and the kid is wearing a monitor from afar, the parent might be, you know, checking in on a regular basis or talking to the school nurse. And so, yes, it's about spending time directly with that other child, but it's also spending less, having less time, having less energy, that there's so much demands on a parent of a kid with a medical condition that there is less time for other things potentially. Why does she always get to miss school and get a prize? So I had to put in that get a prize because I hear that all the time. You know, it's they go to the appointment and they get the day off of school, but then they also come home with something from the gift shop. And I ordered something that's one of the nurses gave them. And again, this is that comparison thing. And like kids at this age have, or school age kids in particular, are impacted by this because they have such a sense of justice and what's fair, right? And is it fair that they came home with a new stuffed animal and I just went to school? And of course, us looking at it are like, and is it fair that they got an IV, but they are not seeing the IV, they are seeing the new stuffed animal. And so, we'll talk a little bit more about, ways to kind of manage that and make them not feel that way. But this is a common feeling that kids have. I have to miss soccer again. So there's a lot of disruption that happens to a family, when you have a kid with a medical condition, whether it's that you can't get your other kid to their activities, or maybe they can't even do the activities because nobody's around to take them, or maybe they get to go, but nobody else gets to watch them. And so disruptions to schedules and activities can be a frequent burden on these children. Why do I always have to do that? So many times children of kids with medical conditions are given increased responsibility. And the increased responsibility can be of many ways. But, both the responsibility of increased tasks in the home. So maybe they have more chores to do. And maybe it's that the sibling with a medical condition, the parent feels, well, they do their own things. They manage taking their medications, and they have to go to a treatment. And so, I feel bad giving them other chores. Maybe the sibling with a medical condition doesn't have the energy to do those chores. So, but from the point of view of the sibling without the medical condition, they're seeing that their sibling doesn't have to make their bed every day and pick up the dishes and clean up after themselves. So there might be more like household responsibility. There also might be some responsibility given to the child to help with the child with a medical condition. Can you help carry their bag? They just had a surgery. They can't do that. Can you, go get me this? You have to help with doing things for that child. So, increased responsibility can be, and again, back to that injustice thing that we see a lot with school age kids. Everyone knows what's going on except for me. That should be for me. So, this is back to the, confusion thing, that feeling left out. So it's not just that I don't have the knowledge, but I feel like I'm not part of this family because mom, dad, and sibling all know what's going on, but I don't. And so I think that that's another sort of experience that children with might feel if they have a sibling with a medical condition. I can't tell my mom because she might worry. So this is something that parents sometimes don't even think about. And I think so many of you might have, listen to this and say, gosh, that's not something I realized was a burden to my kids. So sometimes kids who have a sibling with a medical condition might feel that they have to be the protector of the rest of their family, so that they cannot share, for example, with their parents if they're not feeling well, or if something's not going well for them, or if they're anxious about something, because they don't want to increase that burden on their parents. They don't want to worry their parents. I had a sibling that I saw for a long time, and she was in high school when I began seeing her. And actually her sister had recently passed away prior to that. And she said to me that I am just getting used to sharing with my mom sort of things that are challenging for me, because all through my life, I felt like I couldn't tell her those things because she was so worried about my sister. And I think that happens more times than we realize. So the real question is, before we even get into what can we do to support these siblings, is, do we even need to worry about the siblings? And so what I'll start with is that, siblings of kids with medical conditions are more at risk than their peers to experiencing some, whether it's adjustment issues, anxiety, depression, anger, behavioral difficulties. And I do want to say they're more at risk, but not super at risk, if that makes sense. That a recent meta-analysis showed a little bit of, I would say, like moderate risk. So many children, and we'll talk about this at the end, fare extremely well and actually gain so much from having a sibling with a medical condition. But, it is important to note that these children are a little bit more at risk. And what's really interesting is this recent paper suggests that it's not the severity of the illness that predicts who's going to have a hard time. So a kid, with something that's very maybe life-threatening as opposed to something that seems more minor, that isn't the thing that predicts if the child's going to have a hard time. What actually is one of the main predictors is if the child with a medical condition needs to engage in a daily medical regimen. So you can imagine, this is just a guess to why. We don't know exactly why, but one reason might be that interrupts that sibling's day more. That sibling might not be able, the parent might be less available because they're running a daily medical regimen. That sibling has to wait while they're, they get a lot of attention when they get to take their medicine, and I just have to wait here. And so that's really when it affects the day-to-day is where we see a difference. And it didn't say this in the study, but my sense would be the more intensive the medical regimen, the more challenging that would be. And that, taking a pill, for example, might not have that same impact. And this is the real important part. And again, remember this as, that these children, yes, they are a little bit more vulnerable than your average kid, but there's lots of factors, and open communication and family connections help to protect kids. But so many other things that we're going to talk about today are protective factors. All right, so we got through our first goal, and now we're going to move to the second goal, which is really the focus where I'd like to spend the majority of the time, which is, what can caregivers do to help siblings adjust and thrive? So, and I'm going to say the caveat one more time, because I really do want to bring this home. This is a ideal list. Nobody lives in ideal. We live in reality. And so, Ariana Huffington from the Huffington Post, you might know, created this idea of called micro steps. And the idea of micro steps is taking small steps instead of I want to start exercising and I have to do that 5 days a week for 45 minutes a day, which is kind of unrealistic if you're doing none. What's a micro step towards that? And a micro step might be, I'm going to do 10 minutes 3 times a week. And so think about that concept of micro steps as we're thinking of all these different tips and tools I'm going to give you, and think about what you already do well and you could continue doing. And what's one area that you might want to say, I'm trying to do that a little bit more. I'm going to focus on that. I'm going to pay attention, rather than leaving this talk and saying, oh my God, there's 400 things I have to change. So that's what I'd like everyone to think as we go through these. All right. So first and foremost, and most importantly, is we started with all the feelings they have, right? And so we need to be able to create an open environment that kids are comfortable sharing feelings. And part of that we'll talk about in the next slide is if parents are sharing their own feelings. But, when a kid is looking a certain way or saying something, to ask how they're feeling, to listen to their feeling, to allow space for them to talk about that. But then very importantly, and this will allow them to continue to want to share their feelings, is to validate their feelings. And what I mean by that is to not discount them. It's very uncomfortable. And again, I always think of my own role as a parent when my child is feeling sad or worried. And I try really hard to go quickly to problem solving, or to go quickly to, well, but, I don't spend more time with Emma. I also spend time with you, sort of a defensive mode. And I think it's really important to recognize that feelings are feelings. And if that's how they feel, that's how they feel. Whether it's, the data they're looking at is valid. We'll come back to that later. There's a time and place to say, well, I'm sorry you feel that way, but I do spend some time with you. Let's think about yesterday. But in the moment, to say things when they say, Mom, you only spend time with Joe. You spent all your time with Joe, to say, I can understand that must feel really bad that I do have to spend a lot of time with Joe. So if it's true that you spend a lot of time with Joe, first of all, acknowledge that what they're saying might have some truth, even if it feels uncomfortable to you, and to validate it, to say, I can understand that. And so, allowing space is going to be so important, so that they have, and this is true of any topic, right? So that kids feel comfortable talking to their parents. One way that I've suggested to some families, especially of sort of older school age kids and who might be starting to get self-conscious about talking about their feelings, or just, maybe that's just in their nature. That's their temperament. I don't really like to talk out loud about my feelings, is, having some sort of journal where they can write in it, and their parent is going to look at it. There's other ways they can communicate. Once a kid has a phone, they can certainly text you how they're feeling. And maybe when they're texting you, maybe they don't want to talk in person, and maybe that's okay. Maybe, getting those texts and being able to, that's hard. Getting a text, I'm really sad. But there's something about sharing your feeling off also that helps you cope with it, because somebody else is sharing it with you. So being that place where they can talk about how they feel. And then, I think I sort of alluded to this before about being a role model. And so I'm going to talk about many ways parents can be role models to kids, but one of them is a role model in sharing feelings. And of course, as parents, we might have very intense feelings and feelings that maybe aren't appropriate necessarily to share with kids all the time. But, to some extent, if something really hard is happening, to let them know, yeah, you feel sad or you feel worried about it also is okay. And, you're going to set the tone for what's okay to talk about, what's okay to share, what's okay to show. And not only showing your feelings, but you could also be a role model of how you cope with your feelings. And, so that might mean, being a role model for sometimes when I'm feeling really sad, I go and exercise. That helps me, whether you explicitly say that or they just notice that, or, taking breaks and spending time getting a coffee with a friend. You are role modeling to your children self-care, and that's a great thing. I think there's other ways to be a great role model to these siblings. I always say to families when I'm preparing kids for surgery that calm is catching. Kids, and in particular, I would think siblings who maybe aren't in on all the discussions and don't know what's totally going on, are going to look to their parents for how to respond in various situations. And so if they see that their parent is sort of in a calm place, they will take that as, okay, I don't have to freak out. So it's, again, to the best of your ability, maintaining, you're sharing feelings and letting them know you feel a certain way, but that, you can stay calm. And then, so I think there's just you can't say enough about being a good role model, about taking care of yourself, showing emotions, sharing how you feel, providing information. So talk to these siblings. So when I prepare in my role now in the Department of Surgery, my primary role is preparing kids and their families for medical procedures they're going to have under some sort of sedation, typically. So usually within the department, one of the departments of surgery. And when the kids come in, it's usually the kid that's having the surgery and the parents. But I always make sure, if I know their siblings, to talk to the caregivers or the parents about how we're going to prepare the siblings. Now, maybe the siblings don't need to know what's going to happen in pre-op. I mean, they don't need to know, oh, you'll get your vital signs, because they're not going to be there and it's sort of not super relevant to them. But they will need to know how long will my sibling be in the hospital? What might they look like afterwards? How long won't mom be there? How it's going to impact them in particular. But also, like what's going to be happening. They will need to know that information. So, keeping that in mind, that keeps siblings involved in those conversations, providing information, even after, I have twins, and we came back from a medical visit with one, and the other was like, tell me what they said at the medical visit. And we'll get back into talking about like, how do you protect privacy of the sibling with a medical condition if they want, but like what is information that child needs to know to feel okay? Because often if we don't talk to children and don't give them information, they might be led to be waiting for the other shoe to drop. They might be thinking the worst when it's not as bad as, often I would say they're thinking the worst and it's not as bad as they think it is. Or they might have a confusion about something. And so I think it's really important to along with those feelings, to have just informational discussion that you can ask me questions, and when I can answer them, I will. And when I don't know the answer, I can find the information. And it's okay though to also say, there's some things that are private to your brother, but I will give you any information that's going to impact you. And I think to remember that their questions and what they want to know and need to know will change over time. And this is both developmentally, but also based on their interests and like what's happening with them. And so, they might, I always say, follow kids' lead. When they're younger, they might just want to know, well, so is mom going to be here or not? And the rest is sort of, that's all they need to know. Like, who's going to be here? Who's taking care of me? And as they get older, they might have more questions specific to, why do they have that? Or they might ask a question, will something bad happen? Will they die? And, get the questions usually will get more challenging, but not always. And another question that I'm often asked is, in having these conversations, should we include the sibling with a medical condition in the conversation? And I think that there are times, I think that's a decision to be made per family, sometimes, and sometimes I'll say to the sibling, I want to prepare your brother or sister for what it's going to be like when you have the surgery. Do you want to help have the conversation with me, or do you want me to do it on my own? And I might say to the sibling, are there things you don't want me to talk about? Now, if I think there are things that are going to affect that other sibling, I might say, well, I understand why you don't want me to talk about that, but I think it's going to be really important that they understand what you're going to look like after the surgery, because they're going to see you when they're going to come visit. Or if it's just general talking about, a medical condition, it's not a surgery procedure, just keeping them involved as things change, in particular that are going to impact them. And we'll talk again, I'll come back a little later about how to talk to them about the sibling, what's okay to share, how to share it, like what do they do with that information now that they have it, and it's really is about somebody else. Discuss ways what to say to others. So right now I'm going to get into that. So talk to the siblings about what they're going to say to other people. So I'm using the surgery example again, just because this is something that comes up a lot, and I see obviously in the work that I do. There's 2 kids at the same school, and one of them is going to go be out for 2 weeks to have a surgery. Well, yes, other kids are going to say, hey, where's your brother? What happened? Why isn't he on the bus today? Or they come back and they're in a wheelchair. Why are they in a wheelchair? So things will come up in acute situations like that when a kid is missing, or why do they always leave for appointments, or why do they go to the nurse? And that sibling needs to know how to respond to that. And so part of that is finding out what the kid with the medical condition is saying and giving them similar answers so that we're all on the same page. I also think, oftentimes kids inadvertently think that it's okay to share sort of, you've all had the experience. My husband had the worst one, I think, that I've heard in a long time, where the girls told their teacher that he left them in a hot car locked. It was a crazy story. We all have the kids that go to school and tell some story that, kind of happened, but it wasn't exactly. And so, kids go to school and they tell stories, and maybe they think it's really interesting that their brother pees through a tube. And so they're not trying to out their sibling or share personal information, but they just say it matter of factly, because in our house, it's not a big deal, right? And so when there's something private like that maybe we don't want to share with everybody, it's really important to talk to the sibling in advance and have a conversation that doesn't make it shameful about their sibling, but that this is private. So it's their information to share. So maybe I often say to kids when it's toileting stuff, it's okay to talk about those things in our house, but we really don't talk about pee and poop with other people. And so it's important not to talk about those things with kids at your school. And that's private, that Joey uses the toilet a little different than everyone else, and he can decide if he wants to share that with people, but other people aren't going to make that decision for him. Because I think that, again, it's usually not malicious. It's just, oh, my brother has a baby that the poop comes out of, and it's, they're in kindergarten, they're just sharing the information. And once that information is out, it's hard to take it back. And so just, being ready to kind of, help those siblings navigate this, both the questions, but also just what they are allowed to share just randomly. And my advice to families about, kids in particular, about how to answer questions. I love practicing with kids how to answer questions to see what they're going to say. And frequently when I'll practice with kids, I'll get the answer, it's none of their business, or I'll tell them, I don't want to talk about it. And what I say to kids then is, well, if someone says to you, it's none of your business, or I don't want to talk about it, which you certainly have the right to say, but if someone says that to you, does that make you more curious or less curious? And most kids right away say, it makes me more curious. And so what I want to do is help them come up with an answer that kind of gives enough information to stop the conversation and stop the curiosity, but not so much they feel uncomfortable. So it might be, oh, my stomach wasn't feeling good, so I went to the hospital to get some medicine. Or, I had to have a special surgery on my belly, but I'm okay now. And so you don't have to go, they created an ostomy that the poop comes out and, but, something so that people aren't still curious and asking questions. So I try as hard as I can to practice those with kids, and practicing it with siblings is a really good idea too. So keeping siblings involved. So we talked about earlier where I was like, oh gosh, they're given responsibility they don't need to be given, don't give them too much. However, there's a really great study that just came out that found that when you give kids a job, siblings in particular, siblings of kids with a chronic medical condition, a job, they feel empowered. They feel like we're relying on them, and it makes them feel good. However, it's very specific about the kind of jobs that are going to help them get this feeling of empowerment. It's not the kind of job that would typically be done by a parent, giving medication, organizing things, going and getting equipment, relying on them for medically based things, but giving them a job such as, can you help your brother pack his bag for the hospital? Maybe you can help him decide which toys to bring. Let's go to the store and pick up something for your sibling. Why don't we call every night? You are the one that's going to call and say hi to us, when we're at the hospital. So jobs, maybe they're going to make a drawing for them. So, or keep them company while they're getting, they can sit and watch a movie with them while they're getting their treatment. So, keeping kids involved, but in appropriate ways for a sibling to be involved. So aiming for balance. And what I mean here is to try to establish some sort of balance between all the needs of your various children, right? And this is easier said than done. And as I always say, oftentimes, my attention sort of goes back and forth. It goes more to the kid who needs it in the moment. And when you have a kid with a medical condition, it is going to go more to them for a lot of reasons, right? But how can we make it so it's not totally imbalanced? What are things we can do? And we're going to talk about this in the next slide, but what are things we can do to help that the sibling who doesn't have the medical condition feel like there's more balance? Part of it is just acknowledging the fact, to be aware and saying, we understand that this is imbalanced a little bit and we're working on things. So, some of the suggestions I would make were being aware of creating unfair expectations. So that idea of you have to do chores in the house and you don't, or, you get something and you don't get something. So I talk about rewards a lot. So when I bring one of my daughters in for an appointment here, we'll always end up in the gift shop, as many parents do, for better or for worse. And, it's just sort of like normal for them to also pick something out for their sibling. Now, frequently, they will get a little bit of a bigger prize, but they do get something for their sibling. Most recently, I was with one of them and went into the Center for Families downstairs. And when I went in there, one of the child life specialists there came up to us and talked to my one daughter and said, let me bring you some coloring and some things to do. And she happened to know, because we work together, that she has a twin sister, and she brought an extra package for her. And it makes such a difference. It's a little thing, but every time I have a prize bin, every time the kid says, can I get something for my sibling? I always say yes, because first of all, it's just a lovely thought and you want to encourage that. But it does, it helps aim for that balance. It's still not usually 100% balance. Remember, my one daughter's getting a bigger prize, but we're moving it a little bit more balanced. So just, being aware of those things, ways we can make things feel less unjust to these kids. And then, related to that is finding time to spend with the kid with a medical condition. So oftentimes, without the medical condition, the kid with the medical condition is, spending a lot of time with their parents, whether it's going to treatment and appointments. And the sibling that's all they see is you get extra time with mom. You get to do your treatment. Mom's checking on you all the time. And they want some of their special time too. And believe it or not, so I used to run these sibling shop groups in psychiatry where siblings would come. And I actually think we had this 8-session, very structured, learning about different, some of these things and how to manage your feelings and meeting other kids that had similar experiences. But I actually think if I were to have done a research study, what I would have found is that the most impactful part of that was the parent taking the time to bring that child to Boston Children's Hospital for an appointment. They got to spend the car ride with them. They made it a priority to bring them to the appointment. They maybe got a snack afterwards and went home, so figuring out, is there anything I can do? And be flexible here. Your other kid is in the hospital. You're not getting home till 7 at night. Your child typically goes to bed at 7 at night. Let the sibling stay up till 7:30. That's special time. You stay up with me while I eat my dinner. Let's sit and chat. Finding, hey, if you have the ability and your kid's a good student, can they leave school? Can they go to school an hour late one day or leave an hour early on a day when your kid with a medical condition is just fine and you can have that special time if it's too hard to do it sort of after school or in the evenings or the weekends and there's no one to watch them. Most kids can do okay with missing an hour here or there, to be flexible about what this time is going to look like. Kids really, just in general, thrive on structure and consistency and a schedule, which can be really, some families that have an individual with a chronic medical illness are very structured and scheduled because they need to be, because that's part of the medical condition. But sometimes there's bumps in the road. There's a surgery, there's a medical visit, there's different things that change up the schedule for the week, or just in general, it's always a little chaotic. And what we can do for our kids without the medical conditions is do our best to keep their schedule as consistent as possible, not have them missing out on the things and feeling angry and resentful to the best we can. There are times where even if you didn't have a child with a medical condition, one child might have to miss something and the other doesn't, so nobody's perfect. We can't all follow a routine like clockwork, but doing our best to kind of keep them in their schedule, in their routine, even when we're off at a hospital stay for many days. And I always say, maybe the situation is such that every week's a little different, and that's okay. But maybe when possible, starting each week with a calendar that shows the child without the medical condition, here's what your week's going to look like, and really trying to stick to that. But talking about, sometimes things might not work out, but we're going to do our best to do this. Oops, sorry, going the wrong way. And again, related to this, and to make that possible, you're probably going to need to enlist others for support. And so that might be help taking your child places. That might be just sharing carpooling, or it might be, please take them this day. And again, even parents without kids with medical conditions need to do this sometimes. Taking them to school events. If you can't go to their book reading, is there a grandparent, a relative, a friend that can go to the book reading, somebody, so that they're not totally alone? Also here is listing others, not just friends and family, but making sure the school stays involved and the school stays informed. Because oftentimes, in particular, if both kids maybe aren't in the same school, maybe the school, the teacher, the support staff don't know what's happening in the home, and aren't aware why the homework isn't being completed, or as a parent who's maybe their kid is in the hospital for a week, isn't checking in with their child as much, and so they're not aware that their child is falling behind. And so if the school is aware, if the teacher is aware of what's happening overall in the moment, they can provide some more support, and also some better communication with the parents about, here's what's happening, here's how we can help, can you check in on this? So it's important to sort of, cast a very wide net and think about who can help support. And people want to do something often, especially when it's, a kid who's having an acute medical procedure or something, and they, other families hear about it. They're looking for something to do to help. So it's usually not a burden. Stay connected when apart. And so again, back to this idea that this might be during a medical visit that lasts, that you won't get home till late at night, or it might be, the child is in the hospital because they're ill or needed a surgery, finding ways to stay connected with the sibling that's at home. So different suggestions obvious are, FaceTime and just calling. But there's other fun things that families can do. And so something you might do is write some little notes before you leave. And, if you think you're going to be gone 4 or 5 days, you make 4 or 5 little notes and you leave them. You say you open one of these each day, or maybe they're hidden and they have to find them. Could be that you leave a special stuffed animal for them, or a little prize or something, or notes that somebody who's taking care of them can put into their lunch, just ways to help them feel special, but also connected, letting them know how they can reach out to you and ask you questions and keep up that communication. Planning family fun time. So again, all of us are very busy, and fitting this in is hard enough for a family without a kid with a medical condition that might be involve a lot of time and effort. But there's lots of ways to do this that don't have to be a whole night of, game night or movie night. They could be small things. It could be, and again, micro steps. Does it have to be eating dinner 7 nights a week together? No. Could it be 1 or 2 nights? Yes. When one child is in the hospital, can we still all eat dinner together? Sure, we can. We can go on FaceTime. Can we still do our family game night? Yes, we can. We can do a virtual game of some sort. There's ways to watch movies. I don't even know how to do this, but not you like they have them connected, so you're at the exact same moment at the same time. So there's lots of ways to stay connected, and also to plan time as a family. That it's not just about the sibling with a medical condition or the other sibling or the parents, that we are still a unit. And then, meeting other siblings. So, when I run, like I said, when I ran these sib shop groups, I think probably the thing that impacted most was parents taking the time and spending time with their kids. And probably the number 2 thing was not, again, the activities I planned, but just being with other kids who were going through similar experiences. And so it decreases their sense of isolation, and they feel like they're not alone and they're not so different, and that there's other kids like them. And oftentimes, as I'm going to call it the healthy sibling, you're in a school setting and you're not the identified patient. So nobody, even if there are other siblings in that classroom who might have similar experiences, you might not know that to talk about. But when you, find an online support group, or, various illness groups, have their sort of associations that might have, sibling chats or something, so as they get older, doing that online is something that kids really like. There's lots of camps. So I used to work at the Hole in the Wall game camp for many summers. We'd always have one of the 9 sessions was a sibling session. So it was all siblings without medical conditions who came. And as counselors, that was our hardest week, because those siblings had the most energy and were most excited to be there, and felt really special that there was something for them and something sort of they got out of this. And so, finding ways so that we can say you're not alone. And again, I think, we often think of the kid with the chronic medical condition. Let's find somebody else who has Crohn's so that you can, but like, what about that sibling? Are there siblings they can meet? And of course, as a psychologist, I'd be remiss if I didn't say something about seeking professional support when needed. And so, many of these children are going to do just fine with some of these spending a little extra time with their parents and having an open communication, and are not going to necessarily need to meet with a therapist. But there are kids where, with or without a sibling with a medical condition, need extra support throughout development. Signs that I tend to look for, that I tell parents to look for, is sort of being sad or down, angry more days than not. So not for a day or so here or there, that might be whatever, but more times than not, they don't seem happy. Doing poorly in school when they used to do well. So a change in how they're doing in school is a sign that something could be wrong. Could also be that they're totally confused in math, so don't run, right away. Losing interest in activities that they used to enjoy, so they no longer want to do the things that are fun to them. Acting out more. And then I think something that I talked about earlier that we should keep in mind as parents is there might be the child that those are really obvious. And then there might be some things that are a little less obvious, like the child who's trying really hard to be perfect because they feel as though their feelings mean nothing compared to their sibling that has, a significant medical condition. And so they're not, they're doing everything just right and not sharing with people what's going on in their lives. And those are a little bit harder to assess, but, thinking about that, keeping that in mind. And, as I've sort of been saying a few times, that it's okay not to be perfect. Like this, we're all, I think, I like the perfect, how it's like filling up, like we strive to get close to perfect. None of us are perfect, by the way, none. But the idea of, I'm working towards something, I'm making micro steps. I'm, I recognize there's things I can do for the other child or, the other children. And it's a work in progress. And so please don't be hard on yourself and recognize this is just a place to grow from. Oops, went the wrong way again. And I'll end with just saying what I alluded to at the beginning, that siblings with medical conditions also can gain some incredible qualities and traits from having somebody in their household with a medical condition. And so often I see that those kids have more empathy and insight. They're very loyal to their family. They show tolerance in a different way. They understand responsibility in a different way. Increased problem-solving skills. I see this over and over again, both with the kids with a medical condition and their siblings, sort of, impacting vocational direction. And some, many times, especially for the siblings, that turns into, I want to be in a helping profession or a medical profession. I feel like with patients, it goes one way or the other. It's either I want to do that or I want nothing to do with that, which is fine too. Advocacy skills. They see you as a parent, advocating for in the schools, in the hospitals, at the doctor's visits. And so, they are watching and they are gaining these really, really, really positive qualities. So know that it's not all they're at risk. So that is what I have. And it looks like we have 10 or 12 minutes that I'd be happy to answer questions, or Dr. Bronfman or Annie or Gail, if you guys want to chime in with questions, with answers too, that'd be great.
Thanks. Thank you. That was a great talk. And we already have a couple of questions in the chat or in the Q&A, and I'm going to combine them into one because it's really about where to get support. So will you be presenting a sibling group again through BCH? And do you work with parents or patients or siblings in one-to-one or group support? And I think the question is like, where do you find these kinds of supports in the community?
So I'll answer in a couple ways. So personally, I will not be running a group. I'll just say that. That's not to say that a group shouldn't be run at Children's, but I'm now in the Department of Surgery and just have a different role. I do see kids and families in preparation for surgeries. And so anyone can reach out to the Department of Surgery and meet with me. So we'll put that to the side. But as far as getting support in general, there's lots of ways to get support. We're fortunate in some ways that over the last decade or so, more and more mental health workers have been put into pediatric practices, and that's often a good place to start. It might not be a great if a kid needs more longer term work or whatever, but these people are very good at doing the initial evaluation, initial look. Yes, yes, I'm concerned. No, I'm not. So, or, again, maybe it's just, there's no problem yet. And we want to make sure there's not going to be a problem. That's a great person to meet with because they can usually do short-term work. So I would always start with a pediatrician's office. Do you have a mental health, social worker or psychologist or somebody in your practice? We do have the Department of Psychiatry here. There's often a very long wait list, but that is a place where families can call and find out, if they can see someone there. Many times pediatricians or schools have names of other people in the community so that it's easier to get to. They know, I often, if you're comfortable sharing with the school often, they might not work with somebody, but they've heard, oh, a bunch of kids go to this person and think they're really good. If insurance and having insurance coverage is, from the get-go is important. Often looking at your insurance website and seeing who takes your insurance. There's also things like Psychology Today that you can put in preferences for location and taking certain insurances and what they focus on. So there are ways to get providers. I know it's more challenging now than ever. I think I'd almost always start with the pediatrician's office, or I will say if you have a child that's seen at Children's, which most of you probably do, with a medical condition and they're in a department that has a social worker or a psychologist, potentially the sibling can't see them, but they might have some good ideas of resources in your area. And I have yet to meet a provider of Children's that isn't willing to also help find a resource for a sibling. So, many of the social workers I work with, for example, I'll ask, can you help me find someone for this parent or for the sibling? And they're very willing to do that. Oh, Annie, I think you're muted.
Oh, thank you. Another question. Which is, does the research that you're citing and these ideas for supporting siblings of medically ill children apply to a sibling of a child with a mental illness?
I would think so. I didn't look specifically at research on that. But in my 20 years of practice and, just thinking about things in general, I absolutely think so. There's more attention put to that kid. And maybe it's attention because they're acting out and we're giving them attention, or maybe it's because they're going to appointments. But I would think it would be a very similar type feeling. I think conversations might be a little different about what to share, what not to share, but yes, I think a lot of these principles hold the same. Talking about feelings, how they are impacted by having a sibling who's having a rough go.
Thank you. Another question is about talking to young children about this. This says, we travel out of state and I have 4 children. I often leave, sometimes unexpectedly, with my child with a medical condition. And how do you navigate and explain all of that, the suddenness of that, to young children under the age of 9?
Yeah. So yeah, I think I sort of talked a lot about planned surgeries and admissions, but you're totally right. There's times where, and when it's planned, we can do such great preparation for siblings, but there's plenty of times where we didn't know we were going to get admitted, or we don't, so I think I think it's keeping the communication open. And so even with talking with a younger kid, maybe you're not gonna, so-and-so is, Jamie isn't feeling great today. And how sometimes when she's not feeling great, we have to stay at the hospital to get such special medicine. And so we're going to need to do that, but I'm going to stay with her to make sure she's okay. So they want to know who's going to watch. Especially kids 9 and under want to know. So what's that mean for me? Like, who's watching me? Do I have to miss out on soccer? When are you coming back? And so and some of it you might say, I'm not sure, but I'm going to talk to you every day and let you know. And as soon as I have some of these answers, I'm going to let you know. But, thinking about that, they also want to know what's going on. They want to know, is everything okay? Are you okay? Are you going to come back? About when? How is this? I can't say it enough. School-age kids want to know, how is this going to impact me? So a lot about, here's what I'm doing to take care of you. But I think, sometimes unexpected things happening, and it's really, allowing them to talk about, but you were going to come to my dance. I know I'm really sad that I can't come to your dance show. I really wish I could. I'm wondering if we can get someone to video it or whatever, but acknowledging, yeah, that stinks. I know these things happen. But those are hard.
And also, there's a question here, and it's related to another question that's come in, so I'll try to put them together. Now, I also ask my children how they're feeling about our sick kiddo, and that they're sometimes quiet.
Mhm.
And sometimes also, siblings appear that they don't care
Yeah.
about their sick sibling. So there's the quietness, how do you know what's going on there? And
Yeah.
then there's the kind of, yeah, I'm not interested. Should you worry about that? Be concerned? What does that mean? And
Yeah. I mean, it could mean a lot of things, right? And sometimes they really aren't interested. Like, okay, we do this all the time. They always go and get an infusion. Like, whatever. They're not getting dirt on my stuff, So, and that's okay. Like, that's typical development, So, and lots of kids might not want to talk about it. Maybe they just feel uncomfortable. Maybe they don't know how they're feeling. And so what I would say in all of these situations is, again, to go back to sharing how you're feeling, and sharing, oh, I'm feeling a little, talk out loud. I like to do that thing. Like, oh, I'm feeling a little frustrated because today was, like my kids really aren't asking, but I'm sort of voicing different feelings I might be having so that they're aware, like, oh, mom feels that way too. Even if I'm not actually feeling that way, sometimes I might say it, it's interesting, mom feels, and also by talking about it, maybe they would start to feel comfortable talking about it. But, creating that environment that it's open and you can talk about it, but not forcing kids. Like, you have to tell me how you feel. If you're really concerned and you feel like they're not talking to me, but there's so much going on, that's a great time to see if that person in the pediatric practice can check in with them or somebody else, and you could say it in a way that, I know there's a lot going on. And I know maybe if you're seeing a therapist, I know it's really helpful for me to go talk to someone. I just want you to meet someone. I think you're doing great, but I just think it would be helpful to have somebody to chat with so much going on. And mommy's not here a lot, and, trying to encourage them that way.
And there's an accompanying question with this, which is, when kids are sometimes quiet, are there resources or books that you recommend or sites that might kind of, elicit some of this? I mean,
yeah. So there's, it's like a whole like tool that psychologists even use, like bibliotherapy, where we use books and different stories, especially for kids who might not want to talk about it directly. There's so many, like I wouldn't and a lot of them are disease specific books. So, I mean, I don't know, Lisa, if anything's coming to your mind, but it's hard to say because there's like so many different things. One of the ways I get younger kids to talk about their feelings a little bit more in a non-direct way is I might read a story about a kid with diabetes, or maybe it's less obvious, like just a kid going to the hospital, or a kid that something bad happened, and just try to think so externalize it. Like, so why do you, how do you think that kid feels? So not as much about them, let them talk about somebody else. Another strategy I often use with younger kids, and so that 9 and under, this might help to encourage more openness and talking about feelings in your family, is, whether it's sitting at the dinner table and doing this, or I have a chart that I created that has happy, sad, mad, and worried on it. And I encourage, when I'm starting to talk about feelings identification and talking about feelings, that every night you sit with your kid and say, okay, what's one thing that which feelings did you have today? And everyone has usually more than one feeling. What's something that made you happy, but also sharing your side. Well, I was sad when, and I was worried. So, again, doing that role modeling, but in a more it doesn't have to be about their sibling necessarily, but just starting that open communication, which was sort of back to the old question. The books, like I said, there's a bazillion, and I don't have a specific that comes to mind that hits all disease populations. I don't know if you do, Elisa.
I think because the books are so unique and original, I've looked at them for a number of topics. And what I would say is go to your local library and look them over, because sometimes they have an element in them that doesn't fit your family, or sometimes they uniquely have an element that does. So doing a little bit of homework on your part about what is, a shoe can be a wonderful shoe, but if it doesn't fit you, it's not the right one for you. So
Great.
I feel like doing some homework on that. There are a lot of books. Imagination Press puts out a lot of books on the
Yes,
topic.
that's a great one.
And there's also a lot of illness some from the specific illness community that your child is in, or if it's a mental health issue as well. My brother has autism kinds of books that have been remarkably helpful for kids to read. And I think there's a book on SIB shops specifically talking about how to do them, if that would be, if you wanted to know more about running a group or activities for kids, if that was a useful thing.
And I'm also going to share, somebody has put a book in the chat, so I'll just put it out there, which is, it says, My Name is Jack is a good book. It's a book this person likes and is happy to share it with us. I think we have about 2 minutes left. There are some great comments and questions here. People are definitely interested in having SIB groups. And there's one that is there a curriculum for siblings that could be shared, or a framework that could be potentially used by other programs, and maybe other programs here or elsewhere?
So yeah, so Deb Lobato created the SIB Shops program, and it's a I think it's 8 sessions. I don't remember how many sessions it is. I think you can do it in different ways, but it is a guided way of using it. And I think it's used, across the country by many different groups. And you're right, different illness population groups could use it. And in some ways that would be the best to bringing these kids together that all have a sibling of cystic fibrosis, as opposed to one has cystic fibrosis and one has diabetes, which, still and it's helpful for kids to learn, but they might not relate in the same way. But yeah, SIB shop, it would be what I would recommend.
And again, a lot of appreciation in the chat for this talk. I see that it's 1 o'clock, and that we'll probably have to be stopping in a minute. But I just want to say thank you, Dr. Mednick, for a really great presentation, for joining the Family Medical Coping Initiative. And thank you, everybody, for coming. You will receive a copy, as we said in the beginning, copy of the recording in a short period of time. And we're just really glad you came.